What is this puppy? Okay, were you jealous that I had my own puppy in the last episode? The new Twitter handle at Barky Boy, a hit, by the way.
A hit. All right. Well, this is a new puppy named after the California sky these days.
What's her name?
Smokey.
All right, we're going to learn more about the puppy and break down some health check funding deals. It's the September 29th episode of Health in 2.0.
Oh, I think she's going to go. Oh, she went.
The dog is gone after all that hype. She lasted for exactly 15 seconds of this show, and that was it. Done. Out.
Yeah, she was not that impressed. Wasn't not that interested in stardom, obviously.
Well, maybe she should follow Barky Boy. He's a hoot on Twitter. I don't think he's posted anything yet, but I'm amassing a following.
He needs to ramp up his volume. Big lot of activity going on Twitter.
For those who may have missed last episode, I have been threatening for years to start a Twitter account with a little dog instead of Matthew Holt, only have it be very mean to him and wear Health in 2.0 t-shirts, and it's going to be called Barky Boy, and now it lives. So go follow at Barky Boy.
So it's got one follower who's me.
No, it's got two. I follow it too.
Okay. Well, your Barky Boy, his real name is Jackson the dog. Jackson and Jackson will better start tweeting soon. No time. They don't wait on social media anymore.
John Lynn is going to chime in. All right, you ready? Set your timer. Let's do this.
I have a timer. The Murder Rooster Hornet is ready to go.
All right, here we go. This is one for you, Matthew Holt, to kick off. Papa, which matches college students to seniors, gets another $18 million in a B round. They're reporting 20% month-over-month growth. What do you think of this?
This is a very puzzling one to me. Especially as so Richard, they literally are matching, it was originally college students, but now it's the average, it's like home health aides or other random people to go to home. And it's getting very popular amongst Medicare Advantage plans. 18 million sounds like a lot to me because they're also doing it on video, right? They're going to do video interactions. Why wouldn't you have those people come from the Philippines? Or, there are already people doing that kind of cross-national experiment. And this is one of those things which grows and strikes me. Maybe it's such a simple idea, it's brilliant, but I'm confused.
I kind of like this one. It's growing on me. All right, what about Optimized.Health? They raised $15.6 million in an A.
Yeah, they used to have a different name. They were like figuring around with pills and stuff, and they eventually figured out what they need to do is do remote monitoring. This is another example of that whole growth of remote monitoring. This is a sort of flip side of telehealth, how you manage people with either chronic illness or potentially with things like COVID in the home. So you're going to see a lot more of this stuff coming.
All right, Joint Academy gets $23 million. They do physical therapy. They're kind of like a Kaya, right?
It's from Europe. They're Swedish. The Joint Academy. Doesn't that sound like a 1980s synth pop band? Anyway, they've been in Sweden. They've been in the UK, and this is like about coming to the US. You've got Hinge, which is out there. You've got Kaya, which has got raised some money from Germany. You've got Physera, got bought by Armada. Clearly, musculoskeletal, joints and hips is going to be the next big thing, and they're all coming in. There won't be, 20 of these companies, but there'll be a survivor and we'll see how they do. Yeah.
We said that it was a must-have accessory. All right, what about Maple Corp? They get $75 million. This is a Canadian telehealth company. I know you've been dying to talk to me about Canadian telehealth, so settle in, everybody. That time is going to go, and we're going to be stuck here. And there we are, stuck.
And the rooster got it. Okay, so this is kind of ironic, right? Because you have to really be into this to have this. So there've been a whole bunch of Canadian deals, a couple of Uncle, some others. The Canadians have been throwing their money around and have been quite aggressively getting out there and doing stuff. This is
like Canadian aggressive or like aggressive?
Canadian aggressive. Yeah.
Okay.
Well, but they're the guys who slam you into the boards at hockey and all that stuff. You've seen that for your Chicago boards stuff. But this is you go into your local pharmacy and there's a telehealth thing there that you can do. It's like sort of going into the equivalent of CBS and actually going to a booth and seeing a telehealth visit. And funnily enough, in Canada, this uses regular Canadian GPs who are not allowed to do stuff on the private sector, i.e. for cash payment, that is paid for by the Canadian provinces, their national health or their provincial health services. And I didn't understand how this even worked. And then funnily enough, I found out that because telehealth wasn't previously offered by the Canadian Provincial Services, Provincial Healthcare as a service, a doctor could do a telehealth visit. So they can charge you a telehealth visit, but they can't charge you for an in-person visit. So that's why this is, but this has been a pretty big dip, and they're going quite fast. So I've talked to a number of Canadians about this kind of thing. And yes, telehealth is growing pretty fast. The British Columbia, province of Vancouver, is now already paying into the system. We'll see how it gets sucked into the main thing later. But there have been some other Canadians investing in the US as well. And Canada's going to be quite the activity. So telehealth lives in socialized medicine. That's your headline.
I am really excited about your investigative journalism skills here,
Oh,
Fred.
yes.
Because when I first got subject to this conversation like 2 weeks ago, you were convinced that this was illegal in Canada and that somehow there was some sort of weird loophole that was being exploited to get this paid for because of that GP practice thing.
It is.
So I'm glad you looked into that.
It is a weird loophole, but it's not actually illegal from what I can tell, and they're going to grow. And
when we decide to cover hard-hitting news, we go real deep on the hard-hitting.
At some point, the Americans have got to figure out our irrational system to figure out a way to get stuff paid for by the government on a uniform basis. And at some point, the Canadians and others have got to figure out for their stultified system how they're going to allow flexibility to get innovation paid for, and we're all hopefully going to end up in the same place. I would rather start where the Canadians started because they spend a whole lot less and they seem to get a lot more for it. But that will all change clearly in a few days, few weeks, few months when the ACA gets abolished.
Yeah, talk about that for a minute. So for those who may not have seen Matthew's post on the healthcare blog, he has channeled his inner Joe Biden and written a speech that Biden should give to the Supreme Court justices about the Affordable Care Act.
Well, I mean, real quick, this isn't a tech deal, but the ACA is very likely to be abolished because it's currently been overturned.
This impacts tech. This impacts
everything. It impacts everything in healthcare, including tech. I mean, the reason we have a digital health sector is because of the High Tech Act, which pay for EMRs, and because of the ACA, which basically moved more people, and companies like Oscar and others are completely dependent on that, but also all those companies who are going to do value-based care are kind of dependent on it as well. So it affects everybody. But what I basically said was that, look, if things stay the way they seem to be now, Biden is going to win the election. The Senate will probably go to the Democratic side. But on the other hand, the Supreme Court is going to have one more member who's going to be conservative, and they're probably going to, when they hear the oral arguments for the Texas versus California, which is California versus Texas Act now, which is the one which bizarrely has abolished where the Republican state AGs wanted to abolish the ACA because the individual mandate didn't exist anymore, and therefore it's no longer, as it's not a tax, and because it was held by an FIB versus Sibelius, the one that originally ruled in favor as being a tax. As ever the tax, they say now the whole thing goes down. If that all gets abolished, right, that's going to be heard immediately after the election. So what I said in this piece, please go to TCB and read it, is that Biden should basically threaten the hell out of them with, we're going to go to single payer, because that's all you've left me the alternative to do if you don't step back and let the ACA continue. This is going to be a extremely big deal. Biden's already talking about, he was on TV on Sunday talking about Amy Coney Barrett and her likelihood of being somebody that abolished the ACA. And he's starting there, not starting with Roe versus Wade and abortion, which obviously they're going to come after as well. Why is he starting there? Because there's an election and healthcare is a winner for the Democrats in the election. And all the stuff I've been hearing and what you've been seeing in the Midwest and Florida.
I'm in Florida now.
Florida now. Well, I mean, Florida's still crazily in doubt, but it seems to be the upper Midwest is now going pretty heavily for Biden. And there's a lot of Senate seats that we thought were going to be easily won by the Republicans, like South Carolina and Iowa, seem to be floating to the Democratic column as well. So there's a lot to be done between now and November the 3rd, but it's going to be interesting.
You may have to do a special political coverage.
Well, we can bump up a little coverage of it, but you used to get a lot more political coverage.
I try to spare people from that, but I really do feel like it's important.
Well, it's certainly important. You do hear all about this in TCB Gang, which happens every Thursday as well.
Yeah, so definitely check that out, guys. Definitely go take a look at the piece that Matthew was referring to about Biden's speech. It's got that in the title. So if you get to the healthcare blog, just scroll down a little bit, you'll find it. Read that. And then, like we said, we do a lot more in terms of health policy and politics and talking about those aspects of healthcare on the THCB Gang, which is on Thursdays at 1 p.m. Pacific, 4 p.m. Central. You can just find that on the link via the homepage on the healthcareblog.com.
Every Thursday or something.
I know, right?
You're on it occasionally.
I am on it occasionally to talk about health tech. I'm like a special correspondent. How low is the bar on this show? Tune in and find out. Okay. And of course, don't forget to follow us on Twitter, where the bar is set very, very low. He is at Bolty Boy. The dog is at Barky Boy. I am at Just Amasa. And please,
Smokey hasn't got a Twitter account yet, but she didn't seem very interested, so much she won't get one.
Well, our show dog, the dog that lives in my imagination now, Barky Boy, is at his own handle. And so please sign up for these email newsletters at thehealthcareblog.com and never miss an episode of Health in 2.0. You can also click through on this video, click subscribe while you're on YouTube, and you'll get notified of them there as well. All right, that was a lot of plugging of things. I'm done now. You did a lot of politicking. I did a lot of plugging.
That sounds about normal.
Yeah, totally.
Right. Well, we better figure out. There'll be other stuff. There's still some other stuff in the queue, so we'll be back again this week.
Yeah, we will be back again this week. We'll see you guys soon. Take care, guys.